Hi guys, I hope you're doing well and thank you so much for clicking. In case you're new here, I welcome you. For in this channel, we're going to tackle a health condition. We are dealing with a health condition known as lupus, systemic lupus erythematosus. So systemic lupus erythematosus is a condition where the immune system attacks the health tissues. As I promised in my last video that today we're going to check on the symptoms and the causes of lupus. What is that? Now, before we go to the causes, let's check on the types of lupus. Remember, we are dealing with SLE, systemic lupus erythematosus, but there are other three types of lupus. Which are they? 1. Discoid lupus erythematosus, DLE, Discoid lupus erythematosus. It is a type of contagious lupus which affects the skin. It affects the skin. Discoid lupus erythematosus, DLE. It affects the skin. The next one, we can check on the drug-induced lupus. This is due to the long-term use of the medicines which are used to suppress the condition, which are used to control the condition. Drug-induced lupus, DIL, due to long-term use of the medicine. And this type of the lupus is the same as SLE because it affects different and several parts of the body. Then the next one is a neonatal lupus. As the word sound, as the name sound, neonatal affects the newborn babies, mostly the skin, where the condition is being transferred to the newborn baby. So it affects the skin. It can also affect the heart, but mostly neonatal and discoid lupus erythematosus, they affect the skin. Then drug-induced lupus and SLE, systemic lupus erythematosus, they all affect different parts of the body. It can be the heart, the skin, the kidneys, that all parts of the body. Now, what are the causes of this lupus? It can be DIL, it can be DLE, it can be neonatal, it can be SLE. What are the causes? There are three main causes of lupus. Let's start with female gender. Lupus is more in women than in men due to the estrogen hormone. So this female gender, it's one cause of the lupus, the estrogen hormone. The role of the estrogen, it's believed that estrogen hormone encourages the development of the immune disorders, lupus being one of it, and that is why it's one cause of lupus, female gender, due to the role of the estrogen hormone. And the second cause of lupus is the genetic risk, that is the history. Maybe a family member had lupus and a history of lupus and maybe died because of lupus. So lupus runs in the family. That is, it's genetic. It is transferable from one person to the other. Genetic risk and history of lupus from the family can lead you having a lupus because it runs in the family. The last but not the least, but the main one also, is the sun exposure due to the ultraviolet light. The ultraviolet light affects the skin, where it causes a dead skin cell, and these cells are being exposed to the immune system, where are being attacked, and this propagates to the disease, that is lupus. Those are the main causes of lupus. But there are other three which triggers to the disease. The disease have been in existence, but due to these three causes, it unmasks the disease. That is trauma, stress, maybe due to you're in an accident, and good luck, you didn't die, and due to that stress, due to that trauma, this can unmask the disease. It can unmask the disease. Also, cigarette smoking. You're being exposed to air pollution. This can also unmask the disease. It can trigger the disease. Some infections of different disease such as Epstein-Barr virus, this can also unmask lupus. Having an infection like Epstein-Barr virus, it can unmask the disease. Symptoms vary from persons to persons depending on the type of lupus you have. They vary, they come, they change, they go, but depending on the type of lupus. Remember, we have checked 4 types of lupus, that is Discoid lupus erythematosus, Drug-Induced Lupus, Neonatal Lupus, and Systemic Lupus Erythematosus. But we are measuring on the SLE because it is severe more than other lupus. It is more compared to other types of lupus. What are the symptoms? But remember, they vary. They vary from persons to persons. Now, let's start with muscle pain and joint pain. With lupus, you experience the muscle pain and the joint pain now and then. And mostly affected areas are the arms, the upper part of the hands, arms, thighs, and the neck. You experience pain, the muscle, feeling pain, the thighs, you can't squat. That is some of the symptoms of lupus. Again, rashes. Remember, we said that sun exposure is one of the causes. So definitely you're able to experience rashes in your face, especially the face where you develop a butterfly rash between your nose and the cheeks, the butterfly rash due to the sun exposure, the ultraviolet rays. So on the rashes, you can experience color change in your hands. Then fatigue. There's fatigue. You feel tired all the time. You haven't done anything, but your body feels exhausted. And again, remember, a lupus patient, if you oversleep, you also feel this fatigue. So you're supposed to manage your sleep. But with that, still, you experience fatigue, feeling tired now and then. Then, serious involvement of organs such as kidney, heart, brain, and bone marrow. And in the bone marrow, when it's being involved, this leads to a low platelet blood count as well as white blood cell counts. They are low. And remember, when they are all low, it leads to a cervical anemia. Also, with lupus, you can experience loss of air. There's anemia, there's mouth ulcers, headache, fever, dry eyes, like you have your eyes are so dry. There is kidney disease, heart disease. So as we said, that there is serious involvement of the body organs. But remember, when the bone marrow is seriously involved, it leads to a low platelet blood count as well as white cell count, which leads to a cervical anemia. Lupus symptoms imitates the symptoms of other conditions. The condition, it's mimic. The symptoms are mimic because it imitates the symptoms of other conditions. So if you feel either of any symptoms that we have stated, please go and check out with your doctor. It doesn't mean that you have lupus. It's a mimic condition, meaning that it imitates the symptoms of other conditions. But if you feel either of the symptoms, go and check out with your doctor. Go and check out with the doctor. Thank you so much, guys, for watching. At least now we have checked on the causes. You know now what causes lupus and some of the symptoms of lupus. Till next time, remember to subscribe and to hit on that notification bell that whenever I drop a video, YouTube will notify you. Bye. Till next time, as we explore and know more on lupus.